Hello, everyone. Welcome to another Coach's Clinic. I am Coach JJ. So I will be taking you through the lesson today, and the purpose of today's lesson is going to summarize the common deviations that we had discussed in the previous videos of the previous month related to corrective exercise. So we'll discuss or summarize the common deviations in the body. We will also explain how all parts of the body are connected and also discuss how the fascial tissue system, right, how the functioning of that is largely caused by your daily activities and even your hydration levels. And lastly, we will demonstrate many of the corrective exercises and movements that you can do. Many of these we've already done in the past, so I'm just going to go through a few extra that you can do on your own, especially to target specific parts of the body. Now, the tools that we will use today will include a foam roller. We'll use some sort of sports ball. I have two lacrosse balls here. Massage gun. I'll quickly show you a couple things with that. I will also be using the mobility stick. And if you're looking for these types of tools for your own personal fitness arsenal, then you can visit us at goldenhomefitness.com. Go onto our shop page, and from there you'll be able to browse through the many items that we have, and you can purchase things accordingly. So definitely go ahead and check that out. But what I want to start with is, again, with the past 5 videos, right? We addressed the different regions and ways to correct any deviations that were going on in those parts of the body. Well, to summarize the most common deviations that we had addressed, it was a lack of dorsiflexion, right? So being able to bring your toes towards your shin or bringing your knee over your foot. Also, overpronation in the foot, so collapsing too much on the inner part of the foot on the arch. Medial displacement of the knee, so basically the knee moving inward too much rather than over the toes. It's moving inside of the foot. Also, too much tilting forward, the anterior tilt in the pelvis, to where it kind of gives you the appearance of having like a bigger butt or sticking your butt back behind you, right? With that is also too much curving in the low back. Also, so excessive lordosis, right? But also excessive kyphosis of the thoracic spine. So the mid, upper back, hunch forward, right? We address that. Also, with that, you're going to find that the shoulder blades will move forward away from the spine, right? Also, internally rotated arms. And lastly, too much curvature in the neck with the forward head posture. So those were the common deviations we addressed. If you missed all that, go ahead, check out those videos. You can find those on, I believe on Facebook, but definitely on our YouTube channel as well. So before I continue on, I do want to say that if you are experiencing aches, pains, right, that have been chronic, you can't really explain what's going on, please, consult with your physician or even speak with a physical therapist to get a better sense of what might be going on there. Otherwise, hopefully you can follow along with us today to do some of these movements. And today will definitely be, a lot of more information with some of these movements. So go ahead and bear with me, and I hope you do learn something to help you better understand what might be going on. But many of us know that we have about 206 bones in our body, right? And there are at least 650 named muscles in the body too. So that's a lot of muscle. And we know that there are ligaments that connect bone to bone. We have tendons that connect bone to muscle to bone and muscle to muscle, right? So those are really like the hardware, all right, the parts for the frame of our body. And we do have to understand, though, that the muscles throughout our body, which, usually produce force or even slow down forces, they don't work in isolation, right? They rarely work in isolation, and instead the muscles throughout the body, work as a cohesive unit, right? So that we can actually move the way, we normally do in our everyday activities. So the main structure that holds all of that together, right, is going to be the fascia, right? The fascial tissue that runs throughout our body, right? It's a network of connective tissue, and it's interwoven throughout the body, right? Which includes, the bones, muscles, tendons, ligaments, your organs, right? Even our nerves, right? They will run through those structures. They'll wrap around those structures. They bind those structures together, right? There's just a lot of that fascial tissue, and it helps to integrate those individual parts of the body. There are many lines and layers of that fascial tissue, right? That connective tissue, and it's also the most abundant tissue in the body. So there's a lot of it, right? So hopefully you're starting to get the idea that the fascial tissue in your body it plays a very important role in your health as well as in your well-being. Now, to dive in a little deeper, we have what's known as the excuse me, the superficial front line. So really what that is, it's like a continuous network of that tissue, of that fascial tissue, in the front side of the body, okay, which, like it envelops or encases like the muscles, for example, all those superficial structures. And it helps the body to flex forward, also gives you the ability to extend back. Same thing with the superficial back line, right? It's same concept, can allow you to flex forward and extend back, right? But just more for the back side of the body. And the back side, the back line will attach foot all the way up to the head, okay? And that tissue will help you to stay upright. Okay, so it's very important in terms of that. And I've addressed this in other videos in the past regarding high-heeled shoes, but high-heeled shoes can have a big negative impact on that tissue, because remember, it's not just, high heels that women wear, but also, even dress shoes, work shoes, like boots and whatnot, right? Those can also, even sneakers too, can also be considered high-heeled shoes because it lifts or elevates the heel a little bit higher than the toes. And when we think of the day-to-day implications of that, when your heels are lifted higher, the tissues, the muscles, the fascial tissue in the back of that lower leg, they're not going to lengthen. They don't need to be stretched out as much, right? They're going to shorten. Your body's very smart. It adapts to the stresses that you apply upon it, right? So if those tissues are chronically shortened, then the body's going to adapt to that and allow it to stay shortened. So you're going to get that extra pulling when you do need to stretch it out, and this could lead to all sorts of lower leg issues, foot issues, right? Like plantar fasciitis, maybe issues with the Achilles tendon and so forth. So it's important to be aware of that, right? And I do want to demonstrate something real quick. This is something that I had seen from Justin Price from the biomechanics method, and I loved the demonstration on this. But what we'll do here to show you how everything is connected, we're going to use the lacrosse balls to massage the bottom of our feet, where we have a lot of that posterior, the back fascial line, right? And first, we're going to start by bending forward, okay? And you even here in the studio, you guys can also do this too. So I'm just going to bend forward, and a lot of times you're asked, well, can you touch your toes, right? So that's what we're doing, but you're not going to reach for the toes. I just want you to bend forward and kind of settle into that position. And some of you may already be able to touch the floor. Some of you might get stuck, maybe like just below the knees, okay? But just relax into your position and take note of where you are, where your hands are, and how low you can get. All right, so now, especially for those of you who are tight, you're going to really notice this. But I'm going to sit down. You can do this standing. If you have one ball, you can certainly do this. I'm just using two to help with time purposes. But we're going to massage the bottom of your foot. So you're going to place the ball on the floor and your foot on top of the ball. And we're just going to massage the bottom of the feet. Make sure you find those adhesions, those sticky points, right, that are screaming at you, because we need those to release, and that's going to help the tissue, with the activity that we're going to do next. All right, so doing this, I'd say anywhere from at least 30 seconds, maybe even up to a minute. We'll probably do about like 45 seconds here or there, around there. But just really emphasize the bottom of the foot, the middle of the foot, especially where the arch is. Okay, you can go across, right, side to side, up and down with your movements. But again, find those tissues. If you haven't switched feet, hopefully you've already done so, just for a few more seconds. So I'm going to put those off to the side. And again, I'm not going to reach for the floor. I'm just going to relax down into the stretch. Right, so just relaxing down, and already right off the bat, I'm getting down to the floor much more easily. And I swear, I'm not stretching, I'm not reaching for the floor. But the point I'm trying to illustrate is that fascial line that runs from the bottom of the foot all the way up the backside and attaches to the top of the forehead, right? All you have to do is release some of that tissue, and it's going to give you more range of motion, right? Give you a little bit more mobility so you can move, whether you're holding a static posture or you're going to be moving for sport or other activities, right? So that's why I've been going through a lot of these corrective exercises with the tools such as the massage gun, the foam roller, and so forth for self-myofascial release, right? Because we can get those tissues, not just the muscles, but the fascial tissue to release and allow that movement to take place. But not to stay on the front and the back side, we also have spiral lines of fascial tissue that run from head to foot and wrap around the body. Okay, and these tissues, the spiral line specifically, will help ensure like rotational movement. That it's integrated and seamless. Okay, and what we do in life, including walking, we need to make sure that that movement is seamless. A quick example I can show you, right? If we are in a staggered stance, so that one leg is forward, one leg is back behind, keeping the toes pointing forward, my ankle is kind of flexed, right, so that the knee is over the foot, and I'm going to get a little bit of a stretch here in the front of the hip and the quadriceps, maybe even the side of the torso as well. But if I rotate towards, so this is my right leg, the front leg is right. Turn towards the right, reach up and across with the left, right? Your fascial tissue is allowing you to be able to do that. Some of you may feel so tight that maybe you can only go so far, right? You can't get your arm up. You can barely rotate the pelvis in your spine. So that is what we need to address to make sure that you can turn much more easily so that you're less likely to get hurt with just with daily activities. Now, the fascial tissue, right, all that connective tissue, it provides architectural integrity, right, and stability. So there's a term, I can't remember the person's name off the top of my head, but he coined the phrase tensegrity. Okay, you may have heard that before, but really just think about the combination of tension and integrity, right? So you get tensegrity that way, and I think the best way to illustrate what that is if you think of a tent, right? You have your not strings, but your cables, whatnot, that attach to the ground from the outside. You have your poles on the inside to keep the tent up. But if you have any type of wind blowing, guess what? That tent's going to remain in position. It's going to be able to resist those outside forces from allowing it to collapse. It's going to hold its the integrity is going to hold it upright and keep its shape. So the fascial, the network of fascial tissue does the same thing for our body, and it so basically it's just going to help again from inside and out, kind of resist those forces that might bring us out of alignment, what have you. It'll help keep everything together, right? And our body is the same, as that tent structure, right? But it also can function independently of gravity. So the one thing with like a tent, it can collapse. But with our body, everything is held together. So it doesn't matter where gravity is pulling us, right? If we're on our side, upside down, whatever, right? Everything's still going to be held in place. And, you can think of it this way. If you don't have that fascial tissue, that connective tissue holding everything together, right? Your muscles independently will sag, right? They're just going to hang there. And you can imagine over time, because of gravity, those muscles will get pulled at their attachment points, right? Especially the higher attachment points. It's just going to get pulled down. Also, it's going to get much longer. It's not going to function the way it's supposed to over time. So that fascial tissue holds everything together so those muscles can be in the position they need to be in, right? And closer to the length that they're supposed to stay in so that they can function the way they need to. Now, the chronic aches and pains that we experience, especially, as we get older, we they may develop suddenly, or it's going to be a gradual process over time. Before you know it, you're like, oh, wait a minute, I'm starting to notice this now, right? This pain in my low back or what have you. And oftentimes the source is going to be from repetition, right? So it's based on the movements and the postures that you're repetitively in. And that's what's going to cause the pain. It's not the aging process, right? We usually tie it to aging because that's when you see it. But think about it. The older you are, the more likely you have been in those postures, in the repetitive movements, right? That could be damaging the tissues and whatnot. So, if you've been doing that for much longer, you can expect that eventually you're going to experience those aches and pains, right? So, just because you're older doesn't mean that you should be feeling pain. You shouldn't be, right? If you're taking care of your body, many different ways, in addition with that, physical activity, the self-massage, things like that, which will help. But even diet's going to play a big role in that too. But so just pay attention to that. If you're feeling those aches and pains, your body is warning you that something's going on, and if you don't address it, it's going to turn into something worse. Now, the majority, and this is why you're going to feel this pain too, right? The majority of the sensory nerve endings are found in the connective tissue system. So all that fascial tissue, there are many nerve endings there. So that's why, you might have, like, with a stiff neck, why it might bother you, right? Why it may hurt, right? There's a lot of nerve endings in that tissue. And so, let's understand that when things are out of alignment, right, and there's an imbalance, you have that chronic pain and you have that discomfort, well, it's going to influence the connective tissue, right? It's all under the influence of the connective tissue. So if things are not lined up the way they ought to be, it's going to pull, right, in certain ways, or just not function the way we want them to. And I'll tell you right now, the hydration levels are going to be a huge part of this, right? We understand that we need to stay hydrated throughout the day, drink plenty of water, because our cells need that hydration. And the fascial tissue system is just no different, right? They need to stay hydrated. But the thing is, well, actually, even before I get to drinking water and whatnot, dehydrated fascial tissue is going to be less supportive, right, for your movements, right? It's going to be less responsive. It's going to be less adaptable for the forces that are being applied, whether it be, through your exercise or, just daily activities. So dehydrated tissue is not going to function the way we want it to. And again, the repetitive stress, the everyday activities that we perform, maybe some medications, environmental toxins, a poor diet, the sleep habits, all cause, dehydration. I mean, just living, your cells will dehydrate, right? So drinking water is going to help somewhat, of course, but it's not about necessarily drinking the water as much as getting water or fluid to the parts of the tissues that are dehydrated, okay? And the so the focus should be on getting that fluid to move to those spots. So if we think of a sponge, right? If you have a dried up sponge, right? So it's very stiff, very rigid, and if you run it under the tap, right, for let's say a couple seconds, running water for 2-3 seconds, you turn it off, it'll absorb some of the water, but a lot of that water is just going to run right off of the sponge, right? It's going to beat up and just run right off because that sponge is so dehydrated, it can't absorb that much water, in that short period of time. So this is where a lot of the self-myofascial release techniques can really come into play and allow you to kind of disperse that fluid a little bit more efficiently. If you drink a lot of water, and for many of us, especially if we're drinking more water than what we usually do, you have to go to the bathroom, right, urinate more frequently, right? We say it runs right through us, so what have you. Well, that should be an indication that you're not absorbing all that water. So again, if we pay attention to the movements that we do, as well as the self massaging that we do, that's going to help you utilize more of the water you intake, right? So that your cells, including in your tissues, will hydrate much more efficiently. The dehydrated tissue, right, can cause strain and pain and be the catalyst for many of our pre-pain symptoms, right? So, it's going to play a pivotal role, hydration is going to play a pivotal role in our overall health and well-being, right? So your overall health, obviously cells are hydrated, they're going to function better. But even with your well-being, right, if you're experiencing those aches and pains because you're dehydrated, well, that's going to affect your overall well-being, right, and your quality of life. So we want to make sure that we have that harmony, that coming together with hydrated cells and whatnot. There is a symbiotic relationship between the autonomic nervous system and your connective tissue, right? So we already mentioned that the majority of the nerve endings are in that connective tissue. So they work together in order to manage your posture, your joint position, even that mind-body connection. Also, it's going to allow for a proper muscle connection to occur, right? Because if something is off, the nerve endings aren't firing the way they're supposed to, relaying the message to the brain, then guess what? There's going to be a delay in your response, right? Which could eventually lead to injury as well. But also with better hydration with those tissues, right, there's going to be much better gliding. So, again, with the fascial tissue just being interwoven throughout the body, right, you want that lubrication so it glides better, it doesn't stick as much, right, because that's going to limit a lot of your movement. So you want that gliding to take place, right, and even the tissue over the muscle tissue as well. So now, off of that, what I will do is go through it because there's so much more on this topic that we can address. But if I do that, we'll be here for probably a couple hours at least. So we'll, stop right there with the informational piece and just go through some of the exercises or activities that you can do to help with lubricating those tissues, the fascial tissue, so that you can have better movement. And the first thing I'll show you is going to be for the calf, right, the lower leg. So I'm going to use this textbook. I know I didn't tell you about this at the beginning, but if you have like a larger book, like a textbook, something that's a little thicker too, that can help elevate the leg for this specific exercise, because we're going to use one of the balls here. You can even do this on the floor too. Right? You can still get an effective calf rollout on the floor, but the ball will allow you to put more pressure on that location. So I'm just going to pull this up so you can see this a little bit better. So I have the ball on the book. My leg is on top of the ball, and so I'm just going to support myself as I lean back. I'm just going to roll up and down. With the ball, you'll notice that there's only a certain portion of that area that you can target, right? You can always move down a little bit lower onto the leg, or a little bit higher depending where you're starting. But once you find that adhesion, again, they're usually going to scream at you. Just stay on top of that. You can even push down into it if you want, but just stay on top of that. Allow that release to take place, okay? And then slowly work off of that spot. And then, of course, you would do the same for the other side. And because of our activities and maybe being one side dominant, we may tend to feel this more on one side versus the other. So certainly give that one side a little bit more attention, right? 60 seconds on one side, 2 minutes on the other side that needs more attention, right? 2-to-1 ratio is fine. But just find those knots, those adhesions, and just kind of work through them. So just like we did with the bottom of the foot, right? This is going to be the same concept with the calves. If your calves are tight, it's going to be hard to do even squatting exercises, right? Because if you can't flex your ankle, right, to bring the toes closer to the shin, then you're not going to be able to do a good squat. So those calves are going to be very important. And another thing you can do too, if you have one of those massage guns, this can be great for the calves. And I just repositioned, so I'm kind of more in a side sit type of position, so I can more easily access my lower leg. But when you're using this, you just want to float the gun on the surface. You're not digging down into it. That's a great way to destroy your gun, and break it and then spend another few $100 on another one. So just make sure you float on the surface. And especially since we're trying to hydrate those the cells in the fascial tissue, we don't necessarily need to apply a lot of pressure either, right? Whether it be with the ball, the foam roller, what have you, right? You don't need to apply a lot of pressure. Because sometimes if you apply a lot of pressure, you're just going to put too much stress on those tissues, and it could have the opposite effect. So, and then of course I would just do the same thing on the other side, right? And just float. If you have one of these guns, again, just float. You can even use the ball in this manner as well too. It might be a little bit more challenging because of your position. But these massage guns can be a great tool. I know Coach Kyle's birthday is coming up. He said he just got a massage gun for his birthday. So, they do make for great gifts. But so that's one thing you can do with the massage gun. Now, also for the quadriceps, one thing you can do, which actually might be a little bit better because it's going to allow for less pressure, which would be better, from what I know, better for that lubrication, is just have the foam roller on top of the thigh while you're seated, right? Just like I'm doing here, or sitting in a chair, but just roll right on top of the quadriceps. Again, it doesn't have to be that hard of pressure that you're applying. Kind of roll through it just like on those rollers rolling out a piece of dough. Okay. And then working both sides, of course. And, especially with the quadriceps, you might discover that the outer muscle of the quadricep, not necessarily the outer, thigh, but in the front, but just a little bit more to the outside, right? That may tend to act up on you, right? Or you can feel it much more so. So certainly give that more attention. That's going to be the case for many of us, myself included. Sometimes right in the front, right, front and center. So, but get inside, middle, outside of the quadriceps region. All right, again, help to lubricate those tissues. And what we'll do now is use the foam roller for the, and you can use the gun, by the way, for the quadriceps. You can do the same thing with the gun, just kind of floating it. All right, this is a common area to use the gun for. But I'm going to jump into the glutes. We're going to use the foam roller once again. And if you have one of the longer foam rollers, it might actually be a little bit easier to get into the position you're in, or you want to be in. But you're going to sit on this, and I'm just going to have you cross one leg over the other if you can comfortably do so. If you can't get into this figure 4 leg cross, then just keep your legs straightened. That's fine as well, right? You will hit that region a little differently, but do what you can do. You do have to listen to your body. But we're going to go from the top of the pelvis, right? Definitely no higher than that, all the way down to the sit bone. No lower than that, because then you're going to fall off the foam roller. And to reposition yourself, I like to start right on the top, and then I work my way to rolling to the outside of the hip, right? But just, there we go. Found a spot. But that's the point, right? You're trying to probe, you're trying to search that area, scan that area for those adhesions. Until you find one, then you stay there on top of it until you start to feel it release. And if you are, I'm going to switch here, but if you are feeling a lot of tightness in your low back, don't just think it's only in the low back, because as I mentioned previously in our videos, that oftentimes that low back issue is originating somewhere else, right? So it could be in the hips, could be from lower in the legs, could be from the upper back, right? So you want to address those areas with the foam roller or whatever you can comfortably use to help get that massage. If you have access to a massage therapist, even better, right? Just tell them the areas that you need work on. Good, good. So we'll leave it there and move on to the, we're going to focus on the upper back for this next part. This is where we'll start with the foam roller, and then we can use the lacrosse ball. And on the foam roller, right, you're going to lay on your back, and you want the foam roller more like to start just below the shoulder blades, right? Just below the shoulder blades. You're going to support your head with your fingers. Keep your hands separated so they're not interlaced. So keep your fingers apart. And I'm going to bring the elbows point up to the ceiling because it's going to help pull the shoulder blades from the spine so that we can really work those muscles, whether it be the rhomboids, some of the traps, some of the, there we go. You gotta watch out because my hood was getting cut underneath. So if you have a loose shirt, just be mindful that sometimes it does get cut underneath the roller. But yeah, elbows up to the ceiling. You can roll on one side of the spine between the shoulder blade and spine. And for those of you who have had massage therapy, I'm sure you've noticed your therapist finding those adhesions right there along the edge of your shoulder blade. So this is one way that you can hit it yourself. Yes, maybe it's not as focused as a massage therapist would be able to do, but you can hit it nonetheless. If we move on to the lacrosse ball, if you have two of these, you can certainly use both. I'll just demonstrate with one. And again, you want this between the shoulder. So if this was the spine, this was the shoulder blade, you want the ball right in between. So this is what we're going to do as we lay down. And try to find that tender spot if you can. If you need a pillow for your head because your eyes are looking up and back, then definitely get something to support your head so your eyes look straight up. So now find that tender spot between the shoulder blade and spine. And what you can do here is just rest on top of it, right? You're going to breathe through. And when you feel it start to release, you can even add some arm movement. And what this will do is it'll allow you to not have to move your body through it because it can be kind of awkward or even too painful if you do that. So if you move your arm, now you can manipulate the length of the muscle tissue, right, as we kind of floss our way through. You can move your arm in different motions as well, up, down, swooping out along the floor, right, going across. Okay, so I actually did this with one of my clients earlier this morning, and she loved it because it hit exactly one of the areas that has been bothering her. You feel it, trust me. When you get that spot, you feel it. You're not gonna sit there and jump for joy because you found it, but I'll tell you, after you're done, you should feel much better in that area, even if it's for the short term until you do it the next time, but it will help give you some of that release if done appropriately, of course. But always breathe through the movements. So we're going to stop right there. And this is a great one for those who have that that rounded spine in the mid and upper back. A great one for that posture. So let's go ahead and actually, I don't know why I got rid of this. We're going to use the lacrosse ball or the tennis ball, whatever ball you have, and we're going to target the pectoral muscle right in the front. And it's important to get this tissue because it's going to allow you to open up the shoulder, right, so that you're not just stuck the arm forward. You can actually bring it back a little bit further. So if you just place the ball right there, just below the collarbone, right, so it's going to be like the upper half or upper third of the pecs. And just slowly apply pressure into that tissue rolling out. You can bring it back in as well. Right, and I know I keep moving. I'm just trying to show you the area to target, but again, stay on top of those points that scream at you, all right, those adhesions. And then you can even move more to the front of the shoulder as well, because these tissues tend to be a little shortened as well, right, and stronger. Actually, this part of the shoulder tends to be stronger than the the middle and the back part of the shoulder joint. So this is going to be good to help release as well. So I'm going to do the same thing for the other side. Again, just keeping it below the collarbone. Sorry if I keep hitting the microphone. All right. And for some of you, that tissue right in the chest, right around the pectorals, might need to be a little more sensitive, right? Especially if you haven't done any type of massage work in that area, you're probably going to feel a little bit more. So apply whatever pressure you can comfortably tolerate. But again, just staying in the upper part of the pecs. So we're going to move away now from that self-myofascial release, and we'll just get to a couple stretches. You can use a door frame for this one. What I'm going to do instead, since I'm not near a door frame, I'm going to use this mobility stick. You can use a pole if you're near a pole or have a pole that you can access, something that's a little bit taller. You can even do that too. But for the door frame stretch, if you're standing right next to it, you will keep your elbow tucked into your side, right? So the frame or the pole will be right next to you. Hands on the pole of the frame. And what you're going to do is take the other arm, reach up and over, right, and across so that you can hold on to that frame. And from here, you can push your hip away, or you can even step a little further away so that the arm that's supporting you will actually be lengthened, and then you can reach up and over. What I like with this mobility stick, there's a lot of give to it. So if you keep your elbow tucked in, right, roughly 90 degrees, so your forearm's pretty level, you reach up and across, and then what you can do is push that pull, right, and that will help enhance the stretch. You give yourself that little bowing effect, right, like a little bow and arrow. I like to push the hips forward as well, too, through this. And then, of course, you would do the same for the other side. So again, if you just have that door frame or a pole up and over, move your legs a little further away to enhance the stretch. Or if you have something that has give, then you can get in position and push. I'm always afraid this thing's going to snap, but it's pretty strong. If it does snap on me, I guess everyone will have a good laugh. But now these are very durable, though, so I wouldn't do it if I didn't trust it. Trust me. So next thing we'll do is I meant to grab a stability ball. That was one other tool. If you have a stability ball, you can certainly do this. And Laura, do you mind if you or whoever can get it to me first is fine. There we go. Look at that. Just like magic. All right. So this is a fun one. At first, you might think it's a bit much, especially if you're not used to being on the ball. You might not trust the ball, and that's fine. You can always hold on to the ball. But as I am seated, I'm then going to roll forward. And what I'm going to do is make sure the low back is supported on the ball, right? The top part of the glutes will also be on the ball. And then from here, I'm just going to relax down, right? If your head is down, do not bring it up too quick because, trust me, you're going to feel dizzy. You may even feel nauseous. You don't want to go there. So nice and slow, nice and easy. So you hang out here. You can keep your arms out to the sides. Just relax down. You can enhance this by lengthening your legs so that now you're on your heels. And that'll help to stretch out that front side, right? That front, the superficial front line of the fascial tissue. And then you want to enhance it even further. You can bring those arms up and above your head. This is a fun one. So you can get that full anterior part of the body, full front of the body stretched out. And with what we do on a daily basis, I'm just going to slowly sit myself back up onto the ball. But what we do every day, right, is in front of us. So this is a good way to lengthen those tissues that tend to be so shortened because we're always forward. Next, we're going to do a couple movements here just to show the integration of everything in our body working together, such as with the bird dog. We've done this exercise before where you are on your hands and knees, hips over your knees, shoulders stacked over your wrists. And from here, you're going to kick one leg back behind you, keeping your leg pretty level with the floor so that you can activate the glute, right? If it's up a little higher, as long as you're activating the glute and not arching the low back, then you should be fine. But as you kick that leg back, you're going to reach with the opposite arm forward and switch, right? You're going to keep those abs engaged, embraced, so that helps support your spine, but it's going to allow for more efficient movement as well, right? So you are getting a little bit of a stretch in that front of the leg, right, in the hip, while activating, the tissues on the back side. Same thing with the shoulder, right? You're going to get those tissues all working as well too. The all that connective tissue and muscle tissue right in the torso. It's going to help you stabilize as well. So you have a lot going on there with the bird dog. It may seem easy, but when you really focus your energy on the movement itself, you'll notice that it's a little bit tougher than you may think it is. Rotational lift. If you have any object, I mean, I'm just going to relate it to anything that you might do on a day-to-day basis, right? So if you have any type of object you're picking up from the floor, right, and then you're going to reach up and let's say put it on the shelf, right? You're going to come down. You have a lot of movement there, rotation. You're also moving, forward, a little bit of a side bend maybe, right? Lateral flexion, and you're going to, extend at the hip, right? Straightening out that hip. So there's a lot going on here with that rotational lift. If you're going to use like a weight, like a dumbbell or a medicine ball, right, you can do a similar thing, or even using a cable machine, right, pulling that cable up and across. So, but that is a functional movement because, imagine you're in the garage, you're trying to pick something up, put it on a shelf, right? That's something you need to be able to do, right? Otherwise, everything's going to be here, level with you. But if you can't get that rotation, you're certainly going to be more prone to, getting hurt. So we need to be able to move in those patterns. And of course, the most fundamental of all movements that we as humans do, it's going to be walking, right? Everything is going to be working here. That fascial line really needs, or not the fascial line, but the fascial tissue in general really needs to function because we do rotate through the hips as we walk, right? And as we step, everything's going to be working together. Maybe exaggerated the arms a little bit, but but again, just as an example of how that fascial tissue is going to keep everything together and working together so that you can get the movement patterns we need because we do move in 3 dimensions. So if there's a deficiency in one movement pattern, that's going to affect so much more in other parts of the body. But just remember that fascial tissue, take care of it, because without it, our movements would be next to impossible to do. So hydrate, not just with the water, but also with, light foam rolling or other tools like the lacrosse ball, massage gun, and so forth. That will certainly help you out. And I think that's going to be it for today. So I hope you have learned something from this. Feel free to review this again, at your own leisure. But I do look forward to seeing you again next week. Don't forget about Kyle's Coaches Clinic on Tuesday. Don't forget about Better Body Conditioning by Laura on Mondays, Wednesdays, and Saturdays. So we do look forward to seeing you in those classes. Stay healthy and be well.